So let's go over the bones of the pelvis really quickly as a review, so you can start seeing where these muscles attach, their origins and insertion points. Now let's go over some of these features. Let's start with the ilium up here. So up here, this entire top part of the big elephant ears is called the iliac crest. And it's this margin up here, and it goes around back somewhat, just a little tiny bit. And if you're holding the bone in your hand, you can see this kind of round. This is kind of rounds off like that. And it's a little rough and bumpy. Right here where it comes to a point, and I'll do it over here. See this little point that it juts out? And then there's another little point down here. So this is the anterior superior iliac spine. And so this would be the anterior inferior iliac spine. Now this place between this crevice between the sacrum and the ilium right here, it's the sacrum and ilium, so it's called the sacroiliac joint. See, sacrum and iliac, so sacroiliac joint. And inside of here, the back of the iliac is all rough and bumpy, and that's called the iliac tuberosity. And it's very rough back here, kind of in the sacroiliac joint and in the back posteriorly. This down here is the pubic symphysis. This is where the two pubis bones meet. So this is the anterior view, so this would be the left and this would be the right. This is a joint called the pubic symphysis, and it's SYMPHYSIS, sim like symphony. Speaking of the pubis, this little lip that comes down and hangs over in the front, and it's really rough right here. You can see it really rough right here. These are called the pubic tubercles. Now, what is a tubercle? Anything with the word tuber in it, or also the word trochanter, pretty much all the T words that are a descriptor in these names here, that means a muscle attaches there. So there's going to be a muscle that attaches to the pubic tubercle. After the iliac crest, I'll do it on this side. After the iliac crest, there's this depression in the anterior body of the ilium, and it kind of caves in a little bit. This is called the iliac fossa. And a fossa just means a depression in the bone. Now you can see on here that there is also this bump back here, and this is called the ischial spine. Now that's different from what we looked at before when we were looking at the anterior view. This is the anterior superior iliac spine, iliac for ilium. So back here is the ischial spine. And it's not called the posterior or anything, it's just called the plain old ischial spine because there's only one. Now up here on the ilium is another section. You have a bump here, and you have the bump right here that turns into this notch. So this bump up here would be called, just like the anterior superior iliac spine, this would be the posterior superior iliac spine. And just like this one is the inferior, the anterior inferior iliac spine, this is the posterior inferior iliac spine. And you know, the greater sciatic notch is the big notch between the ilium and the ischium. So you go down below the iliac spines and it makes this big notch, and then below that is the ischial spine because you're in the ischium now. The ischial tuberosity, and remember what I just said, if it has the word tuber in it or anything like that, like tubercle, tuberosity, a muscle attaches there because it's a rough area. If you can see this rough area here. See how this is all rough and has bumps and everything in it? And this is also what you sit on. When you sit down, it sort of cradles your butt. So you're sitting here, this is your butt, and then your legs. So this is tuberosity, but muscles also attached there. And here I'm going to say the iliac crust again, because this is really important because several muscles attach from the iliac crust at different points. So it's really important to keep in mind the iliac crust. Now here's another lateral view. This is facing the other way. So see, here's the pubic symphysis. Here's where the two pubis bones meet. So this would be the front. So this would be the back. And this is lateral, so this is the outside here, because you see the acetabulum? This is where the femur bone fits into. Now we're seeing the back side of the ilium. See, we were seeing the other side in there. But now this is the posterior ilium. So this would be the back of the iliac crust. Do you see how rough it is? That's because a lot of the muscles attach there. And can you see these lines in the bone? These lines coming down? Those are gluteal lines. And I don't think you need to know the names of them, but I just wanted to point them out just so you saw them. The ischium starts right here and comes down and goes down to about there. And then the pubis is this whole thing. And then the rest is the iliac, or the ilium. And here, back here, in the ischium, you see this rough area? How it's got all of this? As I said before, this is what you sit on. This is what your butt sits on. And this is the ischial tuberosity. And remember, tuber, anything tuber is going to be rough and bumpy because a muscle is going to be attached to it. Now, as you can see, this is in 3D, so we can turn it around. Here's the back. Here's the side, the lateral view like we were looking at. And then here is the front. Oops. Here's the front. And as you can see, we can show you the colors. This is the pubic crust and this is the pubic tubercle. This would be where the pubic symphysis is. This is where it connects to the pubis, the other pubis. Here is the iliac crust that I was talking about. And notice there is let me see if I can get it, the inner lip of the iliac crust. And so here's the inner lip of the iliac crust right here. And if you turn this around to see the back of it, you can see the back of the iliac crust. And this would be the outer lip, this big little line right there. You can see this little line back here. This is the outer lip of the iliac crust. This is the posterior ilium. And here's the posterior gluteal line, the anterior gluteal line, the inferior gluteal line. Those were those lines that I outlined in the posterior bottom of the ilium, or back of the ilium. But here, right here, this section right here that kind of blends into the outer lip of the iliac crust, and it's in the back of the iliac crust. This is called the tubercle of the iliac crust. And remember what we said, that if it starts with tuber, then it's probably going to be rough, and it's probably going to be an attachment to a muscle. This is the body of the pubis. This is the pubic tubercle. This is the ischial tuberosity right here. And that's what you sit on. And here's the back of it, just totally the back of it. So this would be your right pelvic bone, because the femur would go right in here in the acetabulum. And so here's the greater sciatic notch. There we go, greater sciatic notch. And here's the ischial spine, body of the ischium. And here's the ischial tuberosity, this whole thing down here. So if you look at this just by itself, here was the ischial tuberosity, the ischial spine, the greater sciatic notch, the posterior, inferior iliac spine, the posterior superior iliac spine. Here's the whole iliac crust in the back, the posterior section of the iliac crust. And we can turn this around. This is the lateral side. So back here is the posterior section of the ilium. Here's the part of the iliac crust that comes around like this. You see the pubis comes down here, and the pubic symphysis is up here in the front where it joins the other hip bone, your left hip bone. Here's where the femur goes in, the acetabulum. Here's the obturator foramen, the big hole. And this little lip that comes down, part of the pubis, there's the pubic tubercle right here. Here's the front. Again, here's part of the iliac crust, and you see it go back. See how this dents in? So that's the iliac fossa. You can see these bumps. That's the anterior, superior, and inferior iliac spine. And here's the pubis right here, pubic tubercle. And here's the acetabulum where the femur fits in. And the ischium is back here. And this is what you sit on. So it's rough behind here posteriorly. Do you notice how up on the head of the femur it looks white? Because it's very smooth, and there's probably cartilage there in the ball and joint socket. And it's very smooth, and it's colored differently. So also I want to point out to you down here, you can notice the same thing around the knee. See, this is white, and here is the posterior. This is the posterior. And down here, this is white. This is the part that fits over your tibia and your fibula to make your knee joint. So these smooth white surfaces, not necessarily white, but just smooth and light, are all condyles. And I think I've pointed this out in some other skeleton videos. But the condyles are just smooth, flat sections of a bone that connects to another bone. That's the place on the bone that's going to connect with another bone. There's going to be another bone right there next to it, or continuing in the limb in this case. So pretty much anytime you see bones connected to other bones, there's going to be condyles involved, because you want it's a smooth surfaces on those sides of the bones when they come together, because you don't want rough areas to be grinding against each other. So these are called condyles down here. And also the prefix epi means above. So down here on the in the femur, there are called epicondyles. So where would epicondyles be? They would be these bumps right above the condyles. So these would be bumps right above the condyles, epicondyles. So anytime you hear the word epicondyle, you know it's just going to be a bump in a bone right above a condyle. Anytime you hear the word condyle, you know it's going to be a part of a bone that connects to another bone. So it's going to be a nice, smooth, flat surface. One other thing I wanted to point out to you on this picture, do you notice how on this, see, this is the anterior, the front, and this is the posterior, the back. This would be the right leg, the right femur, the patient's right. And so do you notice how on the right leg this comes in on the medial side? Like, so here's the median of the body right here. So the left leg is going to be over here. So this would be the center of the body, the center line. Of the body. And so the one in the direction, the side of the femur in the direction of the center line of the body right here, it pokes out a lot more. See, there's a lot more there than how much the other side, the lateral side, pokes out. See, this pokes out much shorter, a much shorter distance than this. And so over here, this is the back of the leg. So this is also the right leg, so you don't get confused. This is just the back of it. So this is, the center line is still going to be this way, and it pokes out much more toward the center line, the median line, or the medial line, than the outside, than the lateral side. Okay? So this is lateral, and this is medial. And that's how you're going to know if this femur is right or left. And you can also tell by the way, the direction the head is facing up here. But for all of the limb bones, like the humerus, also in your arm, in your upper arm, it's going to poke out where the elbow, where it stops right before the elbow, it's going to poke out medially. So that's how you can tell which side is which, if this is the inside or the outside of the bone. So here's a different picture of the femur. This is the anterior view. This is the posterior view. So which leg would this be? Would this be the right or the left leg? This would be the right leg. And this is the front, and this is the back. Now here is what you call the trochanters. Here's the greater trochanter, and it's this whole bump that bumps up and all this rough stuff in there. And here's the lesser trochanter. So greater, lesser, trochanter. And the trochanter, just like the tubercles and the tuberosities, this is another T word, and this also is an attachment for muscles. So pretty much all the T words, I think except for the word transverse, that means, transverse means horizontally, going back and forth, left and right. The trochanters are also a place for the muscles to attach to the bones. But the difference is that the tuberosities are just a rough patch on the bone, on the surface of the bone. And a tubercle is like a rough bump on the surface of the bone. The trochanters look like a pulley. They almost work like a pulley. it looks kind of like a pulley, and it's shaped kind of odd, and that's why they call them trochanters instead of just calling them tubercles as well. It's just a different shape. So here would be on the back side, here would be the greater trochanter, and here would be the lesser trochanter. And on the front side, if you see this line between this indentation between the two trochanters, the greater and lesser trochanter, and let's look over here, just this line on the back side, this line that goes between the greater and lesser trochanters, that's called the intertrochanteric line. Just a line, that's all. Inter means between. Now, not E-N-T-R, but I-N-T-E-R. It means between. And you just have trochanteric is just the adverb form of trochanter. So there's the greater trochanter, the lesser trochanter, and the line in between them. But let's look on the back of the femur for a minute. If you look on the back of the femur, you see this indentation right here. Do you see it? And it goes down, and it's this rough patch, and there's this line that goes down all the way down the shaft. Do you see this line? And it gets rougher up here. You notice how it gets rougher up here in this section? Well, so up here at the greater trochanter and lesser trochanter where they meet, there's this rough patch right up here, and this is called the gluteal tuberosity. Gluteal because the gluteal muscles attached there, and tuberosity again is just a rough surface on the bone where muscles attach. And so the gluteal muscles, your butt muscles, attach from the pelvis. The pelvis is in the middle here, and they go down and attach here at the gluteal tuberosity. And then beyond the gluteal tuberosity, the line extends and it goes all the way down this line right here. This is called the linea aspera. And I don't know, I guess linea is some sort of foreign language for line. I'm not sure what this means, but it's a line. Linea aspera, and that's where some muscles are attached. That's why you need to know this. Now, as I was talking about condyles before, this is the back of the knee over here, and there's this this is actually round. This, you're looking at, it's almost round, like here's the side picture of the femur. The bone comes down, and this rounds off like this. And so what you're looking at, if you were looking at this bone from an angle, you would be looking at this back surface of this round section right here. So these two are round, and they go all the way underneath. They go underneath, and then they come up this way. This smooth surface like this. And so what is a smooth surface? And look at where this is in the femur. This is the bottom of the femur. So this is going to connect you to the knee joint and to the rest of the leg, to the other bones, to the tibia and the fibula. These would be condyles right here, because it connects, it's the smooth surface of the bottom of the femur that connects to the tibia and the fibula. Now, of course, this is the medial side of the leg, of the femur, so this would be called the medial condyle. This is the lateral side, and it's called the lateral condyle. Oops, so that goes all the way down to the condyle there. So these smooth surfaces are called condyles, medial, lateral. And notice that the medial side sticks out way more than the lateral does. And see on the back, on the posterior view, the medial sticks out way more than the back does. Up above the condyles, the medial and the lateral condyles are little bumps right here. Right above, and you can see them kind of on this side too, because they go over on the side of the bone. These little bumps right above the condyles that go over on the sides. They're right above the condyles, so what are they called? That's right, epicondyles. Epi means above, so above the condyle. So this would be the medial epicondyle, and this would be the lateral epicondyle, above the condyle. And finally, one more thing. There is this rough surface right here on the medial side of the femur above the epicondyle, and it's like the little bump that's right here. And there's it's a rough side right here too. And this is just on the medial side of the bone. This is called the adductor tubercle. Now remember, I said most T words, except for transverse, but like tubercle, tuberosity, anything with tube in it, and also the trochanter, those are all places for muscles to attach. And a tubercle is just like a bump where a muscle attaches, pretty much. It's like a rough bump. It has roughness to it, and it has a bump, and that's where a muscle attaches to it. So the adductor tubercle is named that because the adductor muscles attach to it. But the adductor muscles are pretty much the muscles on the inside of the leg. Because they pull inward. So here's the 3D version of the femur, so we can move it back and forth so you can see. So here's the front of the femur, so you can see it attached to the pelvis right here. And here's the greater trochanter. See this part, the greater trochanter. Here's the lesser trochanter. And here's the line between them. Remember, what's that line between the trochanters called? Between is inter, so intertrochanteric line. And then down here, you want to see the adductor tubercle. That's this little tiny bump above the epicondyles right there on the femur. Just this little tiny bump. You can see it better when we get to the back, I think. And then here is the medial condyle. Here's the condyle, because see, here's the tibia right down here. And so there has to be condyles between two bones, and those are just smooth surfaces of the bones so they can fit together. So this is the femur's medial condyle. If you go up just a little bit on the side, it's the medial epicondyle because that's above the condyle. So if we move this over and you look on the medial line, see medial epicondyle, and here's the adductor tubercle. Medial epicondyle, condyle is down here where it touches the tibia. Let's keep going around and see where this green section is right there. That's the adductor tubercle. And then here's the medial epicondyle is on the edge right there. And you notice how the medial section sticks out way further into the medial line than the lateral section sticks out at the bottom of the femur. Now let's turn this around and see the back of it. And there's all sorts of good stuff on the back. Here is down at the knee. Here is the rest of the condyle. Remember I showed you it goes up in like a wheel shaped, and we're looking at the edge of the wheel, and that fits on top of the tibia down here. See, here's the tibial medial condyle and the tibia's lateral condyle. So the femur, the lateral condyle, goes next to the lateral condyle of the tibia, and the medial condyle of the femur goes on top of the medial condyle of the tibia. In between the two femur condyles is the intercondylar fossa. Remember, inter just means between, so intercondylar just means between the condyles, and a fossa is just a little depression there. So that just means this little ridge or depression into there, in between the condyles, intercondylar fossa. And then right up here in the popliteal surface, the popliteal area is just this little triangle right here, which is just above the back of the knee. So that triangle is the popliteal surface. This whole thing is the shaft. I don't think you need to know the medial supracondylar line or the lateral supracondylar line. Let's go up to the top of the femur, and you can see the head. If I turn it this way, you can see where the head fits in. See, there we go. It's green now. See where the head fits into the pelvis, like a ball and socket joint. And then this big bump right up here is the greater trochanter. It's greater because it's higher than the other one. This is lower, so this is the lesser. And this is the intertrochanteric crest or line. It's the same thing. It goes all the way around. It goes all the way around the in between the two trochanters in the front and the back. In the back, it's called the crest, but it's the same thing. It's intertrochanteric, which means between the two trochanters. And then down here, there's this rough patch called the gluteal tuberosity. And the gluteal tuberosity is just a rough patch where muscles attach. So that's named the gluteal tuberosity because the gluteal muscles from up here on the crest of the ilium up here on the pelvis come all the way down, and they attach to the trochanters and they attach to the gluteal tuberosity. So the gluteal muscles attach to the gluteal tuberosity. That's why they named it that. And then below the gluteal tuberosity, the line keeps going, and that line is the linea aspera. And I always think asparagus for some reason. That just reminds me of aspera, so that's how I remember it. Okay, so now we're on to the lower part of the leg, the tibia and fibula. If you notice that here's the fibula and here's the tibia, and there is a space in between here, in between the two bones. Now this actually isn't just open air like it shows on this picture. There is a membrane that connects, that attaches to both bones and connects the two, and it's a pliable membrane, but it kind of keeps them both together, and this is called the interosseous membrane. Now inter, remember, means between, and osseous is just a term for bones. If you remember when you were studying the bones, the bone cell is called an osteon. Now if you notice on the top of the tibia here, you can see that there are these smooth sections on the top here. And why are they smooth? Because they articulate or connect with the femur that's up here. I'm just going to write this over the kneecap, over the patella. But the femur actually comes down behind the patella and connects on top of the tibia like that. So between the two bones, you have to have smooth surfaces so they don't grind together if they touch. So what are those smooth surfaces of the bones called where they connect to other bones? That's right, they're called condyles. Also, I want to point out down here on the very bottom, on the bottom of the fibula, do you see how the fibula extends down and it makes a little bump right here? And see on the back here, you can see it, it extends down and there's this little bump right there. So you can kind of consider it, that's kind of part of your outside ankle, your lateral ankle. And then you see the tibia as it comes out and sticks out into the median line. Remember, the bones of the limbs always stick out more, see further, than laterally. Laterally, they don't stick out too much. So we know this is the medial side, the inside of the inners of our legs. So this section of the tibia that sticks out down here at the bottom, you can kind of consider that your inside ankle. And these ankle bumps, as you want to call them, the bumps on both the tibia and the fibula, laterally and medially, they're called a malleolus. And just consider malleolus to be a word for your ankle. I don't know if it actually means ankle. This is going to be the name for these features of these bones. Also, I just want to point out where these bones meet. Up here, the tibia and the fibula meet right here. And on the back, look how it is on the back. So really the tibia makes up most of the knee joint with the tibial condyles. And the fibula connects down a little bit lower than the tibial condyles. And where these connect is called the tibio-fibular joint. So that's pretty easy to remember because it's a joint in between the tibia and the fibula. And the one on the top here, you just want to put the term superior. You just want to add the term superior. Down here at the bottom, that's right, these would be called the inferior tibio-fibular joint. Now your shin bone is just the anterior surface. The top here, of course, is the head of the fibula. It's over here too, the head. So this is going to be the right leg because you see on the anterior view, the fibula is on the outside, it's lateral. And the tibia would be medial. So the femur comes down and the femur is going to be right up here, right above the tibia. And the tibia, since it's connecting to the femur, is going to have condyles on the top. There's two of them because the femur has two condyles to match up with the two condyles of the tibia right here. So this would be on the medial side. This condyle would be on the medial side. So it would be the medial tibial condyle. And so of course this other one is going to be the lateral. And over here on the posterior view, you can see the shape better of the condyles. You see how this comes up right here, and then this comes up right here. Now between these condyles, if you look on the posterior view, right here, between these condyles, this is going to be the intercondylar inter meaning between, Condylar meaning condyles, so between the condyles. Intercondylar eminence. Now what I really want to get into and show you is this space right here, this area right here of the tibia. This is the anterior section of the tibia in the front, and this is like a rough bumpy patch right here, and it's on the front of the tibia below those condyles. Here's the condyles. So this rough bumpy patch, this rough patch on the bone, a rough patch on the bone is called a tuberosity. And since it's on the tibia, we call it the tibial tuberosity. And what is a tuberosity? It's just a rough patch of the bone where a muscle connects. And finally, down here on the bottom, I showed you the way the fibula comes out into a little bump right here, and the tibia on the inside of your leg comes down into a little bump right there. And we call those the malleolus. So this one on the inside, on the tibia, because each has one, the tibia has a malleolus to go on the inside of your leg, and the fibula has a malleolus to go on the outside of your leg. So the tibia, the tibial malleolus, is just called the medial malleolus because it's on the medial side. And of course the malleolus on the fibula is just going to be called the lateral malleolus. So here's a 3D image of the tibia. So we can turn it around like that and look at it. This is the anterior surface of the tibia. This is the front. This would be your shin bone. So that's the anterior border right here. Just that little green line, anterior border. Right up here is what I was talking about, the tibial tuberosity. Now up here you can see that there's the condyles. You can see the sides of the condyles because the condyles are actually on the top of the tibia because that's where they articulate with the fibula. You see this tibia, it sticks out more on this side, so this would be the medial malleolus. So as we turn this around to the other side, this would be the side that connects to the fibula. So this would be where the interosseous membrane connects. See, it says interosseous border. That's just where the membrane connects. And if you turn it around to the back, this is the posterior side of the tibia. This is obviously the inside of your foot, the medial side. And here's the medial malleolus, the back of it. And these lines are, here's the cilial line and the vertical line. You don't need to memorize those for your bones, but you do need to know about them because you need to know where that's sections where the muscles attach. This groove, the intercondylar fossa, inter meaning between, condylar meaning condyle, so between the condyles, and a fossa is just a little depression. If you turn it around and look at the front of the tibia, this is going to be the anterior intercondylar fossa, but where it sticks up at, there's the intercondylar eminence. So the eminence is the bump that sticks up in between the condyles, the intercondylar eminence, and then the intercondylar fossa would be the depression between the two condyles. Now here is the top of the tibia. So you can see here is the front of the tibia. So this would be the tibial tuberosity. You see this bump coming out, and there's a rough patch on the front of the tibia right here. But you can see the condyles a lot better. Here's the lateral condyle. Here's the medial condyle. And the outside are the borders. This is just the border. These are called plateaus, the tibial plateau. Tibial plateau. I don't think you need to memorize that for your bones, but you do need to understand that these condyles are the smooth surfaces that connect in the knee. And once again, here's the tibial tuberosity, the rough area where muscles connect. This is a tubercle, which also, remember the T words, except for transverse, but the tuber words and tuberosity and tubercle are rough patches. The tubercle is more of a bump, and the tuberosity is more of a rough patch. But this tubercle is also where things connect. It's called Gertie's tubercle, but I don't think you need to memorize that for the bones. But you should be aware of the fact that there's tubercles and places for muscles to attach all around the top of the tibia here. Now here's the fibula. So here is the inside of the fibula. This would be the interosseous border. That's where the interosseous membrane attaches to attach it to the tibia. Here's the anterior border. So this is the front. This is the anterior of the fibula. Here's the head up here. And then there's a little tiny styloid process that sticks out there. What's a styloid process? Well, remember, a process is a section of a bone that sticks out. That's all process means. And styloid is like in the shape of a stylus pen. It just means it's real pointy. It comes out as a little pointy section that sticks out from the bone. So styloid process. And that's at the top of the fibula. And this whole side of the fibula, the head and the styloid process that connects to the tibia right here. The tibia would be right next to it over here on this side. Here would be the outside of the leg, the lateral section. And down here, see how this bumps out? This is the lateral malleolus. Here's the neck of the fibula. And if we turn this around, this would be laterally on the outside. Here's the back. And it's pretty much the same thing. See, the styloid process sticks up. Here's the medial malleolus, and do you see where it goes down a lot more, extends down? So that would be the bump starting your ankle bump. And that's pretty much it.